The pharmacist's role in addressing SDOH has not always been well defined, and published literature suggests pharmacy curricula do not consistently integrate components of SDOH. I think this resource guide has potential to help fill this gap. And boy, does it ever. And I want to make sure that we transition here successfully so that Chris can come in here and really get your perspectives on where PQA should be taking the social determinants of health resource guide that we plan to develop. But first, so here at PQA Studios, we have been operating in a bubble as we've been planning and preparing for the PQA Leadership Summit. We're not as intense as the MBA, but we have been taking the precautions in order to maintain our social distance and prevent the spread of COVID-19. We're also going to take those precautions as we transition to our next session.
Well, I want to thank you all for bearing with us in this era of COVID. Even our stage transitions take a bit more time. And thank you, Lauren, for the introduction, and a big thank you to our panel and all of those who've been engaged with us throughout the day today. We thank you again, Lauren, for helping us ensure social distancing, of course, with that tape measure and all. You know, we've had a great series of discussions today, and I want to thank all of our audience members for tuning in and for your continued engagement. And as we've heard throughout the day today, there's so many opportunities to address the social determinants of health. And with the question that Lauren just posed at the end of his previous session, really that stands before us is, where do we start? And this is where we're looking to you, our members, today as well. Our focus on SDOH and its place as a strategic priority for us in 2021 is driven by the fact that there is not an existing resource focused on SDOH interventions as they relate to medication use quality and pharmacy services. We here at PQA hope to build that resource. To give us focus areas heading into 2021, we need the help of you, our members, to guide our work through the polling exercise beginning in just a few moments. You have the opportunity to answer 3 questions about the 7 SDOH areas presented today and featured in the Summit's pre-read document. To help us better understand the perspective of our members, we also invite you to share which sector you represent. This is not a formal vote, and you are not being asked to provide the official position of your organization. However, this is an opportunity to capture the sense of our diverse membership. This is an opinion poll, and we want you to be guided by your experiences, your insights, and your priorities, both as an individual and in your role as a healthcare quality professional. We will only report aggregated scores and will not be tracking or reporting any individual answers from this poll. The collective input you share will serve to direct our team as we build a resource guide in the year ahead. We'll dig in deeper on these issues with subject matter experts over the coming months and years. However, in case you haven't seen enough live results this week, we'll take a look at our scoring results in the latter part of this session that you all have input in. Here's how the polling will work. You will have 3 minutes to answer each of the polling questions. The first 3 questions will focus on the SDOH areas we have discussed today. To begin, we want your input on priority areas for improving medication use quality. For each SDOH area, you can rank the area as having a low, medium, or high impact. There's no right or wrong answer here, but of course we want your opinion. You are limited to answer 3 high impacts for up to 3 of the 7 areas. We recognize that each of the areas is very important in its own regard, but to help us determine the key focus areas for PQA to address first, we ask that you limit your high impact answers to only 3 areas. You may answer medium and low impact as many times as you see fit. Let's take a look at a couple of examples before we begin. For instance, as you can see here, if I thought that screening, food security, and social isolation had opportunity for highest impact, I would mark these as high. The rest are filled as medium and low. In the next example, I may only think that 2 areas have the opportunity for high impact, such as safe and decent housing, as well as transportation. So I mark these 2 areas as high. For other areas, all other areas, are marked medium or low, as you can see here. And now it's your turn. We recognize that you may not need the entire time allotted to complete this poll. If that is the case, take a quick break to grab some refreshments or just stretch at your desk. Just be sure you're back within 3 minutes. If you scroll down from this video stream, you will see the polling questions. If you are in full screen mode, exit full screen and then scroll down. Please take a few moments to answer. And be sure to click submit when you are finished with the poll to ensure your answers are recorded. If time runs out before you click submit, not to worry, as your answers will be recorded as they stand at that time when it runs out. And of note, if you are having difficulty accessing the poll or seeing the poll, please contact the tech support in the lower right-hand corner of your screen, and they will be able to assist you further with sending you the direct link to the poll. So go ahead, take those 3 minutes, and go ahead and answer that poll. And welcome back. Next, we want your input on the ability of pharmacists and pharmacies to address these SDOH areas. The same 7 SDOH areas are present for this question. We are also using the same scale. For instance, if you think pharmacists or pharmacies have the opportunity to greatly impact an area, you will mark the area as high. Once again, we're limiting you to 3 high-impact answers to help PQA focus its efforts. To answer this poll, scroll down from this video once again and take a few moments to answer this question on the ability of pharmacists or pharmacies to address each SDOH area. Be sure to click submit when you are finished to record your answers. Once again, if time runs out before you press submit, your answers will be recorded as is when time runs out. For our final SDOH question, we want to know what our members currently do for each of these SDOH areas. You will have the opportunity to select multiple answers for each SDOH area, including screening, referral, and intervention, depending on what you are aware of your organization doing. Let's take a look at an example together to better understand this polling question. As we can see here, for cost of medications, if my organization conducts screening and has an intervention associated with that screening, then I would check both screening and intervention for the cost of medications row. Also from this example, my organization does not currently have screening, referral, or intervention for food security, so I leave that row blank. However, for social isolation, my organization conducts screenings, has referrals, and also has a direct intervention to address this SDOH area. So I check all 3 boxes in that row. With that in mind, it's your turn. Scroll down from this video and take a few moments to answer this poll. We will give you 5 minutes this time to ensure that you have time to answer the poll completely. Please click the submit button when you have completed the poll to record your answers. Finally, to help us have an idea of who participated in the polling today, please fill out a simple multiple choice question on which PQA member sector you identify with. Scroll down one final time from the stage to complete this polling question, and we'll give you 2 minutes to quickly complete this final poll. I want to thank you all for your input today. As a member, your input is of critical importance to PQA as we seek to develop an SDOH resource guide. Now, let's take a look at today's results from your input that we've had in the last few moments. First, in the areas of opportunity to improve the quality of medication use. And from your answers here, taking a look live for the first time, I'm along with you at this time as well. Within our impact equality on safety and medication use, we can see that screening for unmet needs and cost of medications, as well as cultural and literacy barriers, were our 3 top areas according to your votes. And the ways that we arrange these here, you'll notice that there's no scaling along the bottom, but these are all relative to one another, depending on how you ranked them. And so a higher ranking resulted in a higher scoring to that particular area of social determinants of health. You know, I find this really interesting too, just from what we've discussed throughout the day today with our varying panelists. You know, this is really echoing a lot of what we've been hearing about the impact that we can have specifically on these 3 areas, from the screening aspects and leading to those referrals within these other areas. And certainly this doesn't detract from the other areas that were slightly lower here. As you can see, relative to one another, these were all very close to one another. And we really do hope that this will help us to begin to shape out what's of highest impact that we can have on that quality of medication use for our members to be serving within their communities in the year ahead. So I'd like to go to the next slide as we're looking at the results, looking at the ability of pharmacists or pharmacies to impact areas within the social determinants of health. And so what can pharmacists do about this? And again, looking at these together live here, I can see that very similar overlap within those 3 areas, and even more emphasis, I think, here on really where pharmacists can have an impact. Screening for these unmet needs, as you can see here as well, with the cost of medications, as well as those cultural and literacy barriers. And so that overlap really helps us here at PQA to see that there's kind of this clear top 3, if you will, areas to address first, if you will, once again. And again, we realize that pharmacists can have impacts across these areas and on these other areas as well. But as we look to focus our efforts and really start to shape out this guide for the use of you as a member, we really do hope that these high impact areas, as well as the high ability of pharmacists to be using our resource guide, will really allow them in order to have that impact and utilize this guide in a meaningful fashion within your communities as well. And so finally, to see what our members are doing here as well, and what you're already perhaps doing within these areas. And so we'll go ahead to our final poll here that we'll take a look at today. And you can see that our screening is in gray, our referral is in orange, and our blue is our interventions here. And it's really great to see, once again, interventions as far as cost of medications. As we talk about having, again, high impact on medication use quality, it's wonderful to see that our members are already having interventions in place for these things. And we will be, again, referring to our members over the year ahead as we build this resource guide and hope to bring folks together on this to make it meaningful for use across the country with the quality of medication use. So in addition to that, looking at our live results here once again and seeing these in real time with you, looking at, again, our cultural and literacy barriers, conducting quite a bit of screening as well as interventions there as well. Food security, having a lot of referral pieces that go on, which again, we've heard about throughout the day today when it comes to food security. Looking at housing, once again, with those referrals, and I think it goes back to when I was listening in on Lillian and Jill's conversation this morning with Richard, really, you know, the interventions and that you can have that help, you know, again, from the pharmacy perspective, just having easily accessible healthcare providers that are available to their patients and can refer them to the appropriate programs here as well. So it's great to see both, again, within social isolation, transportation, lots already going on once again as far as referral, intervention, and screening across the board there. And so thank you all again for your input today. This is extremely meaningful, and we hope that this has been insightful to you all as well, that you're not alone in these efforts, that your other members of PQA are also participating across the board in trying to address the factors of social determinants of health, and that we will be coming together again in the years ahead to try and form this resource guide for the use of our members as well. So thank you again for your input. It's, as always, is a very high value to us, and we will be, again, continuing this work in the years ahead.